If you used to wake up every morning without even thinking about it, and now it just doesn't happen, this video is going to explain what's actually going on. And I want to start with something that might surprise you. Most men who notice their morning erections disappearing immediately assume the same thing: low testosterone. Maybe even the beginning of erectile dysfunction. And while those are possibilities, the real picture is more complicated. And for a lot of men, more fixable. Here's what we're going to cover: what morning erections actually are and why your body produces them. The 4 systems that have to work simultaneously for one to happen. Why testosterone is only one of those 4 and why the other 3 are the ones most men never check. And at the end, whether this reverses, because for most men it does, and I'll tell you exactly what that looks like. Stay with me, because the answer most men find when they go looking for this is incomplete. And incomplete information on this particular topic leads men to either panic unnecessarily or miss something that actually matters. First, what morning wood actually is, because most men don't fully understand the mechanism. The medical term is nocturnal penile tumescence, or NPT. And despite what a lot of men assume, it has almost nothing to do with dreams or sexual arousal. Morning erections are produced by your body during REM sleep, rapid eye movement sleep, the deep sleep phase where dreaming occurs. During REM, your brain goes through a process that, among other things, triggers erections. This happens automatically. It happens whether you're having a dream about a beach holiday or a work meeting. Most men experience 3 to 5 of these erections per night during sleep, each lasting 25 to 35 minutes. The one you notice is simply the last one in the cycle, the one still in progress when your alarm goes off. Here's why this matters. Morning wood is not a vanity signal. It is a functional test your body runs while you sleep, checking that your blood vessels, nerve pathways, hormonal system, and sleep architecture are all working. When one of those systems fails, the test stops running. That's when the erections disappear. For a morning erection to happen, 4 systems have to be working at the same time. This is the part most videos on this topic skip, and it's why so many men go straight to testosterone and miss what's actually causing their problem. System 1, your vascular system. An erection is fundamentally a blood flow event. Your penile arteries need to dilate, fill with blood, and maintain that pressure. If your cardiovascular health is compromised, high blood pressure, early arterial stiffness, poor circulation, that blood flow is reduced. And because the penile arteries are among the smallest in the body, they show vascular problems before your heart does. No morning wood can be an early cardiovascular warning by 3 to 5 years. System 2, your nervous system. The nerve signals that trigger a nocturnal erection travel from the brain through the spinal cord to the penis. Nerve damage from diabetes, chronic inflammation, or even poor sleep position can interrupt that signal chain. When nerves are the problem, testosterone supplementation does nothing because the signal never arrives. System 3, your sleep architecture. Morning erections are produced during REM sleep. If your REM sleep is being disrupted by sleep apnea, alcohol, stress, or simply not sleeping long enough, the erections disappear regardless of your testosterone or cardiovascular health. Sleep apnea in particular is strongly and directly linked to both the loss of morning wood and to erectile dysfunction through a completely separate pathway from hormones. System 4, your hormonal system. And yes, testosterone is part of this. Testosterone levels naturally peak in the early morning hours between 4 and 8 a.m., which is precisely when the last nocturnal erection is occurring. When testosterone drops, that morning peak flattens. Morning erections become less frequent and eventually stop. But here's the critical distinction: testosterone is 1 system out of 4. And in clinical practice, vascular problems and sleep disruption are often identified as the primary cause before low testosterone is even confirmed. Now, I said at the start that most men assume this is testosterone, and some of them are right. But here's the number that changes the picture. Studies show that men with normal testosterone levels still lose morning erections when their sleep, vascular health, or nerve function is compromised. Which means if you've had blood work done and your testosterone came back normal, something else is doing this. And I'll tell you exactly what to check in a moment. So if testosterone isn't the only explanation, what are the 3 things most men never check? Here they are, in order of how commonly they're the actual culprit. Number 1, sleep disruption, and sleep apnea. This is the most underdiagnosed cause of lost morning erections in men under 45. Sleep apnea interrupts REM sleep repeatedly through the night, sometimes dozens of times per hour, without the man ever fully waking up. He has no idea it's happening, but his nocturnal erections are being cut short every time his breathing stops and his body partially wakes to restore it. If you snore, wake up tired regardless of how long you slept or have been told you stop breathing. In your sleep, this is your first check, not a testosterone panel. Number 2, early vascular changes. The penile arteries are roughly 1 to 2 millimeters in diameter, significantly smaller than the coronary arteries. This means reduced blood flow shows up as erectile problems years before it would show up on a standard cardiac workup. Men in their 30s and early 40s who lose morning erections with no obvious hormonal cause frequently have early arterial stiffness or elevated blood pressure that hasn't yet crossed the clinical threshold for diagnosis. Fasting blood glucose, blood pressure, and cholesterol are the 3 numbers to check, not just testosterone. Number 3, cortisol and chronic stress. Cortisol, your stress hormone, directly suppresses both testosterone production and the REM sleep quality that morning erections depend on. A man under sustained work, financial, or relationship stress can have perfectly normal testosterone on a blood panel, but still lose morning erections because cortisol is chronically elevated and degrading both sleep architecture and hormonal signaling simultaneously. This is why morning wood sometimes disappears during high stress periods and returns on its own when the stress resolves. Now, when is it actually testosterone? Because it absolutely can be, and I'm not dismissing that. Testosterone levels decline at approximately 1% per year after age 30. By the time a man reaches his late 30s or 40s, that cumulative decline can cross the threshold where morning erections become noticeably less frequent. This is normal age-related change, not a pathology, but it does have real effects. The specific signs that testosterone is likely the primary cause rather than vascular or sleep issues are: the loss of morning erections came alongside a drop in overall libido and sex drive. You also noticed reduced energy, motivation, or mood changes during the same period, and your morning erections didn't disappear suddenly but faded gradually over months or years. That gradual fade pattern is characteristic of declining testosterone rather than the more abrupt disappearance caused by sleep disruption or vascular changes. A morning testosterone blood test taken before 10 a.m. when levels are at their daily peak is the correct diagnostic step, not an afternoon test, which will return a lower reading regardless of your actual hormonal status. 2 minerals play a direct role in testosterone production and morning erection quality that I've covered in dedicated videos on this channel. I'll link them at the end because if testosterone is your issue, the mechanism those 2 minerals work through is exactly where you want to start. Before considering anything more aggressive, the question I promised to answer at the start: does morning wood come back? For most men, yes. And the recovery timeline depends entirely on which system is the actual cause. If sleep disruption is the cause, morning erections can return within weeks of improving sleep quality or treating sleep apnea. This is one of the fastest turnarounds because no structural damage has occurred. The machinery is intact, it just wasn't running. Men who get a CPAP device for sleep apnea frequently report the return of morning erections as one of the first changes they notice. If cortisol and stress are the cause, recovery follows the stress. Men who go through a high-pressure period and then genuinely decompress, whether through lifestyle change, reduced workload, or consistent sleep, often find morning erections return without any supplementation at all. If testosterone is the cause, recovery is slower, measured in months rather than weeks, and depends on whether the decline is being addressed through lifestyle changes like resistance training, sleep optimization, and zinc and magnesium sufficiency, or through clinical intervention. If early vascular changes are the cause, this is the longest recovery timeline and the one that requires the most consistent lifestyle intervention: cardiovascular exercise, dietary changes, blood pressure management, and in some cases, medical treatment. the pattern that matters. The earlier you identify which system is failing, the more reversible it is. Morning wood disappearing is not a diagnosis, it's a signal. And signals are most useful when you act on them, before they become something harder to fix. Let's bring it together. Morning wood disappearing is your body's signal that one of 4 systems needs attention: your vascular health, your nervous system, your sleep quality, or your hormones. Testosterone is one of those 4. Not the only one. The 3 most overlooked causes in that order: sleep disruption and sleep apnea, early vascular changes showing up in blood pressure and blood glucose, and chronic cortisol elevation from sustained stress. Check those before assuming testosterone is the story. If testosterone is the cause, the zinc and creatine videos linked below cover the 2 most important minerals for supporting the hormonal and nitric oxide pathways that morning erections depend on. Start there. If this channel covers what you need, you know what to do. The next video is already linked. See you there.